What if I told you there are science-backed supplements that can help diabetics not only manage their blood sugar, but also effectively? Yep, real science, not hype. Stick around, because in this video, we're breaking down 5 powerful supplements that have shown results in clinical studies. These aren't magic pills, but they be a real game changer for diabetics trying to shed pounds. Hey everyone, welcome back to our channel, your go-to spot for expert health tips, science-backed wellness advice, and real-world strategies to take control of your health. If you're new here, make sure to hit that subscribe button and tap the bell so you never miss a video that could literally change your life. Today, we're diving into 5 supplements that actually help diabetics lose weight, backed by research, not rumors. Whether you're pre-diabetic, type 2 diabetic, or just trying to drop extra pounds while managing your blood sugar, this is the video you've been waiting for. Losing weight with diabetes is a unique challenge. The insulin resistance, blood sugar fluctuations, and medication side effects make it harder than it is for the average person. And while diet and exercise are always key players, supplements can offer that extra push, if you're using the right ones. But here's the problem. The supplement market is full of empty promises, flashy labels, and zero scientific backing. You don't need hype, you need facts. So we went deep into peer-reviewed studies, clinical trials, and nutrition science to find the top 5 supplements that have real, measurable impacts on both blood sugar levels and fat metabolism, especially for diabetics. But before we jump in, this video is for informational purposes only and does not substitute medical advice. Always talk to your healthcare provider before starting any new supplement, especially if you're diabetic or on medication. Everyone's body reacts differently, and your doctor can help guide you safely. Let's get into the 5 supplements that actually help diabetics lose weight. 1. Berberine. Berberine is one of the most well-researched natural compounds when it comes to both blood sugar regulation and weight loss. It's a bioactive compound extracted from several plants, and it has been used for centuries in traditional Chinese and Ayurvedic medicine. What makes berberine so powerful is its ability to activate an enzyme in the body called AMPK, often referred to as the body's metabolic master switch. This enzyme plays a key role in regulating metabolism, improving insulin sensitivity, and helping the body use fat for energy. In fact, multiple studies have shown that berberine can be as effective as metformin, a commonly prescribed diabetes drug, in lowering blood glucose levels. What's more, participants in clinical trials also experienced moderate weight loss, improved cholesterol levels, and better insulin response. The typical dose is 500 milligrams, taken 2 to 3 times daily before meals. However, it's important to take it consistently and monitor your blood sugar closely, especially if you're on diabetes medications, as it can enhance their effects. 2. Chromium picolinate. Chromium is an essential trace mineral that plays a critical role in carbohydrate and fat metabolism. Specifically, chromium picolinate, the most bioavailable form, has been shown to improve the way our bodies use insulin, the hormone that regulates blood sugar. For diabetics, especially those with insulin resistance, chromium can be incredibly beneficial. It helps stabilize glucose levels by improving the efficiency of insulin, which in turn reduces sugar cravings and makes it easier to stick to a healthier eating plan. Several studies have also suggested that chromium supplementation can support modest weight loss, especially when combined with a calorie-controlled diet. Most people take between 200 and 600 micrograms per day. While results won't be drastic overnight, chromium can be an excellent long-term support tool for those struggling with blood sugar swings and weight management challenges. 3. Glucomannan, konjac root. Glucomannan is a natural water-soluble dietary fiber extracted from the root of the konjac plant. It has a unique ability to absorb water and expand in the stomach, which leads to a feeling of fullness and helps reduce overall calorie intake. This is especially useful for diabetics, who often battle with post-meal blood sugar spikes and hunger pangs. Because glucomannan slows the emptying of the stomach, it also slows the absorption of glucose into the bloodstream, resulting in more stable blood sugar levels after eating. Clinical studies have shown that when taken before meals, glucomannan can contribute to weight loss, lower fasting blood glucose, and even reduce LDL cholesterol. It's generally recommended to take 1 to 2 grams with a full glass of water 15 to 30 minutes before meals. But a word of caution, because it expands in the digestive tract, it's important to stay hydrated and start with a smaller dose to assess tolerance. 4. Alpha-lipoic acid, ALA. Alpha-lipoic acid is a powerful antioxidant that is both water and fat-soluble, allowing it to work in every cell of the body. It's naturally produced in small amounts and also found in foods like spinach, broccoli, and organ meats. For people with diabetes, ALA has shown significant promise in improving insulin sensitivity and reducing symptoms of peripheral neuropathy, a common complication of diabetes. But that's not all. ALA also helps the body convert glucose into energy more efficiently and has been linked to reductions in body weight, especially visceral fat around the abdomen. In clinical settings, patients supplementing with ALA have seen improvements in fasting blood sugar, reduced inflammation, and even a mild boost in metabolism. The usual dose ranges from 300 to 600 milligrams per day, often taken in divided doses with meals. And because of its antioxidant properties, it offers a layer of cellular protection, which is an added bonus for those managing chronic conditions like diabetes. 5. Green tea extract, EGCG. Green tea extract is rich in catechins, the most important of which is epigallocatechin gallate, or EGCG. This compound is well known for its metabolism-boosting and fat-burning properties. In diabetics, EGCG does more than just support weight loss. It also helps stabilize blood sugar levels and reduce oxidative stress, which is especially important in managing long-term diabetes complications. Clinical trials have shown that green tea extract can increase fat oxidation during exercise, improve insulin sensitivity, and reduce abdominal fat when taken regularly. It works by increasing the hormone norepinephrine, which helps signal fat cells to break down fat for energy. When combined with caffeine, even in small amounts, the fat-burning effects are amplified. A typical effective dose is between 250 and 500 milligrams of standardized green tea extract per day. Just be mindful of the caffeine content if you're sensitive or already consuming other sources of caffeine throughout the day. So there you have it. 5 supplements, all backed by real science, that can support weight loss and better blood sugar control for diabetics. Remember, these are not miracle pills, but when paired with healthy eating, regular movement, and the guidance of your healthcare provider, they can give you that extra edge. If you found this video helpful, do me a favor. Hit that like button, share this with someone who needs it, and subscribe if you haven't already. And let me know in the comments. Have you tried any of these supplements? What worked for you? I'd love to hear your story. Until next time, stay strong, stay smart, and take control of your health.